Hey Deb, how are you today?
Good. Thanks for stopping up here at the Outpatient Infusion Center. I am just getting ready to prepare for a patient to come see us. So I was gathering some supplies and I'm going to go into the room. We have patients that come from a variety of areas in our community. Some drive as much as 2 hours away. We serve ages 9 and up. So I can take you into one of our rooms and kind of show you what's in the room and how we set up for a patient. So this is one of our patient rooms. We do have 6 private patient rooms up out here on our unit, and they have a recliner that they can sit in. We have a television for them to watch. We offer warm blankets, snacks, beverages, and if they're here for an extended stay, we can offer them a meal that's brought up. Some of the services we provide are injections or IV infusions for a variety of things. We give antibiotics, we give medications for chronic illness, hydration, and electrolyte management. We do what we call a bladder installation for people that have bladder cancer. We do blood transfusions and phlebotomies. We also do port and PICC line dressing changes and lab draws. So one of the things that we do have up here also to make the patient more comfortable is a vein finder. That's a little device that lights up the veins and it makes it easier for us to find them if they're difficult to see. We also are part of the vascular access team of Mary Lanning, which provides services also for people with poor vasculature or difficult IV starts, where we use an ultrasound machine to find the vein and place an IV there, as well as longer term IVs like a midline. So in order for a patient to be seen here, we just need to get a doctor's order, and if their insurance requires prior authorization, the physician takes care of that as well. And then once we have those things, we call the patient and get them scheduled to come in. Some of our patients are here for maybe only 15 minutes if they have an injection, and some as long as 6 hours or more. So the amount of patients we see in a day varies based on how much room we have available to meet the needs of the people that have the longer IVs as well. So this is our vein finder. It lights up, as you can see, the veins. So if a person has a deeper vein or it's hard to visualize it, it just helps us to be able to find it easier and hopefully not have to have as many attempts at an IV, having less sticks for them. And then this is just our ultrasound machine that we use. When we put it on a patient, it'll light up the veins and we can see them, and then we actually insert the needle based on looking at the screen rather than the vein to be able to get the IV in for people that have difficult IV access. Thank you for coming by today. We'd be glad to have you up here as a patient if you're needing our services.